Welcome to the page on depression, depression triggers, anxiety, and anxiety triggers. My name is Dr. Qaadri. Unfortunately, depression and anxiety are very common. There are many people who are suffering from feeling sad for a lot of their life. There are many reasons. Some people have grown up in very difficult circumstances. They might have suffered either physical or mental abuse as children. Sometimes the wounds that they've suffered in childhood continue to haunt and discolor their life experiences throughout their adulthood. Some individuals may be going through too many challenging life events too fast, whether it's losing your job, a divorce, death of a loved one, or a major illness. All of these types of events can challenge even the strongest and most resilient of us. Some people feel particularly upset and alone at the holiday season and during special times such as family birthdays or anniversaries. So how do you know if you're depressed and or anxious? Symptoms of depression, symptoms of anxiety, what you experience in depression, what you experience in anxiety. There are a number of different symptoms. For example, sleep. People will have trouble sleeping. Usually they can't fall asleep, and when they wake up, they feel that they're not rested, no matter how long they've actually been in bed. That's the usual scenario. Some people actually sleep too much and would prefer not to get out of bed at all. Lack of interest. People lose interest in the activities, the hobbies, and friends that they enjoyed before. They just stop experiencing the color and variety of life. Guilt. People feel too guilty, like everything's their fault. They keep replaying the same negative encounters, the same bad videos over and over again in their own minds. They're always trying to second-guess themselves. If only I had done this, if only that hadn't happened, things wouldn't have been so bad. This guilt can be very consuming. Energy. People will feel constantly tired, fatigued, and listless. They just don't have the get up and go that they used to. They feel down and just want to be left alone. Concentration. People feel that they can't concentrate, that they can't focus on the task at hand. They might be reading, for example, and find that they've reached the end of the page but have understood little of what's written. They find it difficult to come up with words, forget names too easily, and find themselves wondering what they were doing just in the middle of actually doing something. Appetite. Most depressed patients lose their appetite. They don't feel like eating. They have to force themselves to have nutrition. Foods that they liked before and even enjoyed and found tasty have just lost their appeal. Agitation. Along with feeling down and depressed, people will also alternate with feelings of anxiety or nervousness. They're excessively worried about what will happen tomorrow, how things will play out. Will they be able to get through their circumstances all right? They can get frequently upset, agitated, and angry. Sometimes that anger can be directed at others, at the outside world, but frequently it can be directed right at themselves. Suicide. The worst case scenario is when a patient feels that life has become too much, that it's just not worth living at all. They actually attempt to end it. This scenario, of course, is a medical emergency. Depression and anxiety quiz. To give you a firmer idea of depression and anxiety, I've developed a self-rating scale. As you fill out the questions, it will help you to score yourself to learn if you're depressed or anxious at the mild, moderate, or severe levels. The questions are answered on a scale, a self-rating of 0 to 5. Consider this simple statement: I take good care of my health. If you feel that this applies to you completely, choose 5 or always. If you feel that this does not apply to you at all, choose 0. For those in the middle, choose 1, 2, 3, or 4, again depending on which side of this question you see yourself. Now for the scale itself. Remember to rate yourself on a scale of 0 to 5. I have trouble sleeping. I wake up in the early morning. I feel tired even after sleeping. My appetite is down. I have lost interest in things, my hobbies, even sex. I have lost my ability to enjoy myself. I dwell on my past mistakes and feel guilty. I am restless and agitated. I think things are my fault. I have little energy and get tired easily. I can't handle the stress in my life. I am quiet and silent. I have trouble concentrating and thinking clearly. I feel unhealthy and sick. I have constant aches and pains. I feel sad and hopeless. I feel scared and anxious. I cry easily. I feel my life is useless. I think about suicide. The score rating is as follows. 0 to 40 means that you're likely not depressed or anxious. 40 to 60 means mild depression and or anxiety. 60 to 80 means moderate depression and or anxiety. 80 to 100 means severe depression and or anxiety. More than 90 is considered a medical emergency. Dealing with depression and anxiety is an involved process. It usually involves a good mixture of talk therapy and or drug therapy. It's important to discuss with a doctor what combination is best for you. While medications can certainly help, they are not meant to replace a supportive environment and a good therapeutic rapport and relationship with your doctor. Medications can particularly help people get over rough spots as they help to rebalance brain chemistry. But talking with a professional, a caring, live human being, is irreplaceable. What's also notable is that unfortunately, too many people allow themselves to live in a depressed or anxious state for a long time, sometimes for years, sometimes even for their whole lives. They don't realize that help is available, or they just don't access it. But a caring health professional can help a great deal. So experience the full color and variety of life. Don't let depression and anxiety rob you of your happiness.